Hi, I'm Dr. Siddharth Vinod Mehta. I'm an ophthalmologist, cataract and a refractive surgeon working at Mehta Eye Clinic, Ghatkopar. So before a refractive procedures, first we need to know whether your eyes are eligible or not. So the first factor is your age. It needs to be above 18 years of age. The second factor is the glass power has to be steady, at least for a year or so. And the third important factor is the corneal measurements, the curvature of the cornea, the thickness of the cornea. They should be absolutely in the normal range. There shouldn't be any abnormalities. And if all these three factors are in the normal range, you can actually go ahead and for the refractive procedure. For doing this, there are specific tests that we need to do, like topography, taking care of the corneal thickness, and a proper good refraction is needed. All these factors are important, and these, whatever data is collected here, is now synced to the actual laser machine. So now the laser knows exactly what to treat and how to treat it. Refractive procedure is not a very long procedure. It just takes about 15 minutes or so. We don't really inject, so it's not a really painful procedure. What we do is we put the anesthetic drops into the eye, and that numbs the eye. All you feel is a bit of a pressure and just a sense of bright lights. Post-surgery is when most of the patients feel little bit discomfort, like watering. They find it difficulty to face the light, and there is a foreign body sensation mainly for the first 4 to 8 hours. Next day, most of the patients are absolutely fine, and by the third day, they can actually start resuming the normal work. In fact, even start using their computers. Post-surgery, the major problem is dryness. This dryness usually settles with time. It just takes about few weeks to months, and this is mainly because the corneal nerves are healing, and once they heal, the dryness subsides. The other major problem is glare and halos. Again, this settles within few weeks or a few months. Mainly, there is a neural adaptations. Your brain starts accepting that, and it starts settling down. This usually doesn't stay for that long, but we have seen few patients, they recover within few weeks, but some may take few months. But all in all, most of them, they settle within the first 6-8 months. The main medication here is to have good lubricating eye drops. Maybe the frequency of these lubricating drops will be more initially, and once it starts settling, you can slowly reduce it. But we recommend to use this lubricating drops for the first 2-3 months at least.